amazing. Like, you come into this work, and because the ask is so large, a lot of times you go for so long and then you have to sit down just to take care of yourself. The consortium does a very good job of staying in there, staying consistent, and actually filling the gaps that are in the space that need to be closed. And so I am just so grateful to be a part of this. For even though I came in the middle of the decade, just being able to see the work that has been done and see it up close and from afar has been amazing.
Happy 10th anniversary, Sickle Cell Consortium.
Rose Bailey Millard here, wishing the consortium a very happy 10th anniversary and many, many more. Great job. So very, very proud.
Happy 10th anniversary to the Sickle Cell Consortium. I just want to say I am so proud of Dr. Bailey and the team.
Ms. D, I am so grateful for the community. I am so grateful just to be able to celebrate with you all for 10 years. I thank God for this community, because for so long I was by myself, having sickle cell and not really having anyone to understand me or anyone to talk to. And I was introduced to SC3, and I'm so grateful for the progress, the growth, the unity, and the family that I have found.
When I showed up with the Sickle Cell Consortium, it was an automatic outbringing of love, and they helped me to be able to grow and to function in this space well. And I am proud of the work that I have done with their group. And now it is our 10-year anniversary, and we are celebrating all of the wonderful things that we do and everyone that we made an impact on. So if you can come with us and celebrate with us, we would appreciate it, and we're glad to have you here.
Hi, I'm Etta Carter. I'm the General Assembly President of the Sickle Cell Consortium. Happy 10th anniversary.
Hi, I'm Doris Bailey. I'm the Co-Director of Finance with the Sickle Cell Consortium. The Sickle Cell Consortium is my baby, and I can say that in many ways. My daughter is the Executive Director and co-founder of the consortium, and it started from a place of love and a place of wanting to do something for the community, to make sure that the community voice is heard in so many ways. And that resonates deeply with me, since my daughter was diagnosed at the age of 3 and was hospitalized for the first time at the age of 5. And our voice haven't always been heard. As a mother, as an advocate, as a caregiver, I've had to go into many different places and make our voices heard. I've talked with doctors, I've talked with nurses. You name them, they've come into the room. I've even had nurses, I've told nurses, don't come back. If you have to touch my daughter and cause her pain, don't come back. And I've talked to their managers, their supervisors, and so forth, and they could not come back. And since we love people, the nurses and doctors would stop in the room to laugh and talk with us, and the nurse that I told she could not come back would stand at the doorway and look in. See, our voices have to be heard. Anything that anyone else can do, we can do. There's no limit to our abilities. We're doctors, we're lawyers, we're patients, we're advocates, you name it. We get high school diplomas, we get bachelor's and master's and doctorate degrees. We're judges. We could even be the President of the United States. Give us time. Our voices must be heard, and it should always be heard. And as the Co-Director of Finance, it gives me pleasure to go out to the different industry and request and ask for money, because I think the Warriors Convention is the one I love the most, because so many people can come. Warriors that have, maybe the children haven't gone on vacation yet, can get scholarships and bring your child to that beautiful hotel. They have all these, they have the swimming pools and have the different things. And in this July, we'll be in Florida, go to Disney and so forth. It's an opportunity to come out as a family, as a tribe, to come together and meet your family, meet your friends, meet your sickle cell family. And what I've seen is that children, they come in, they connect with each other, the next year they're looking forward to coming back to see those friends. So the consortium offers opportunity to come together as a family, to have our voices heard, to love on each other, and I like that aspect. I like the leadership summit because the leaders can come together and learn from each other. And then Dr. Bailey likes to bring different things for the community to learn from. And I talk about Dr. PJ. She calls herself PJ, Peanut Butter Jelly, PBJ, because she came and she taught us about disrupting burnout. See, as caregivers, as warriors, we get burnout, and sometimes we don't know how to deal with it. But Dr. Bailey brings the resources in to help with that. So I just love the consortium. I love the caregivers. I am a caregiver. And sometimes caregivers get tired. But we're there 24 hours a day, and we love being there. So it's good to have a place we can go and talk with each other. We have that community, and that's good. So there's so much about the consortium that I love, not just because my daughter is the executive director, but because it brings so much meaning to so many people and bring people from so many places. We're even overseas now, and people are coming in, and we're able to help some communities, maybe small dollars, but the small dollars go so far. So I guess that I can just say that I love the community. I love the work that I do. We work endlessly trying to get everything pulled together to make sure we can have a convention, make sure we can have a summit. And Dr. Bailey, Sharonda Sykes, Dominique Goods, and so forth and so on, work tireless. You don't know the hours they put in. 2 o'clock in the morning, they're on the phone working. Different cities, different states, they're still working, trying to bring things together. I go to bed. I wake up, it's 3 o'clock, and I say, you guys need to get off the phone and go to bed. But they said, we have to get this done because we want the community to have this and to have that. So I guess I could go on, but I'm gonna take a breather and just say that the work that the consortium is doing is so meaningful and it helps so many people. Happy 10th anniversary, Sickle Cell Consortium, 10 years, happy 10th anniversary, happy 10 years, wow.
The consortium was founded 10 years ago. Well, 10 years ago, we received all of our paperwork to become a full 501c3. We were founded based on an idea. We wanted a place where patients, caregivers, community-based organizations of all sizes and types could come together on an equal playing ground to define their problems, the needs, the gaps that they see within the sickle cell space, and then address those gaps. I've said many times, helplessness is a learned response. And here at the consortium, we believe that if helplessness can be learned, it can be unlearned. We provide the platform to ensure that not only can you point and say, that's a problem, you also have the capacity to now say, and here is what I think is the solution, and then talk to others. Pinpoint, throw around all kinds of ideas, have a brainstorming session, and come up with a way to address that problem, that need, or that gap. We are a collective of over 90 community-based organizations all over the world and over 70 independent patient and caregiver advocates, people in this space who are key opinion leaders. They are educators, they're advocates, they are in the healthcare space. All the different stakeholders come together, see the problem, now work together to fix the problem. That's why the consortium exists. And while we're here and we have all of these different partners and stakeholders together, it's also a fantastic opportunity to provide training. We can provide training on infrastructure support, how to grow your organization, capacity building, training on getting grants, writing grants, DEI and federal grants. What has changed with the new administration, and how can we keep our advocacy efforts strong and our community-based organizations valid and working towards a common goal? It's also an excellent opportunity we provide for all of our partners and the different stakeholders to come together and learn about the updates in the community. What's going on? What's industry up to? What's transformative therapies looking like? And to put people in a room with those who can answer those questions directly. The Sickle Cell Consortium was addressed to provide that platform to ensure that sickle cell patients and caregivers, warriors, we are the ones that are finding the solution, fixing the solution. We are at the center of sickle cell education, research, advocacy, legislation, and policy. Happy 10 years to the Sickle Cell Consortium.